Good morning, everybody. Thank you so much for joining us today. I'm Catherine McKenzie, and I head up Global Citizenship and Sustainability for Abbott. For those of you who don't know Abbott, we're a global healthcare company, and we're focused on bringing life-changing technologies and products to improve people's lives. And that's why I'm really thrilled to be here today to lead this discussion on the role of businesses to achieve better health for all. I'd like to thank the Chamber of Commerce Foundation, first of all, for convening this important discussion with our esteemed panelists, who I'm going to introduce in just a moment. Good health is the foundation for everything. It is what leads the backbone of thriving individuals, of economies, of societies, and it's what makes the business case for advancing health so compelling. And I think that's something that's been vividly illustrated these past years with COVID. We've seen the impact of that on our own lives, on our communities, on our workforce. But the pandemic only accentuated a number of systemic issues and barriers to health that have existed for a long time. As we look ahead, health threats and the environment are only going to become more challenging. And I want to start with a couple of key stats. By 2030, the difference in life expectancy between rich and poor countries is going to be 18 years. We are going to need 20 million additional more healthcare workers. And by 2029, spending on healthcare is going to double to nearly $16 trillion. In short, our world needs new approaches to health. And breaking down big systemic barriers requires a shift in thinking, innovative business approaches, and meaningful partnerships. This is something we've been thinking about for a long time at Abbott. We have an ambitious goal of reaching 3 billion people in the world by 2030. And to do that, we need to change the way we're approaching business. Business as usual won't get it done. So first of all, we are working on intentionally designing, innovating for access and affordability into our processes, from research and development to the way we bring products to people who need them. And in partnership, we're looking at new approaches to health in a very integrated way, whether that's an initiative about diversity for clinical trials or through partnerships like our Future Well Communities program, where we're supporting people with diabetes through a very integrated approach, whether that's access to health, healthy food RX, and looking at those other societal determinants of health. So we're seeing similar dialogue happening across industries, and that's why it's so fantastic to be with both of you today, and I'd like to introduce my panelists here. First of all, I'm pleased to introduce Dr. Jay Batt, Executive Director of the Deloitte Center for Health Solutions and Deloitte Health Equity Institute. Jay, I know Deloitte recently made a $1.5 billion commitment to advance equity and build on the work of the Deloitte Health Equity Institute. We also know you're on the front lines of healthcare as a practicing physician, so looking forward to hearing about those experiences. And Tracy Malone, Senior Vice President of the United Health Group and President of United Health Foundation. Tracy, I was excited to see United's recent $100 million investment to address healthcare workers shortage and support clinicians from underrepresented communities. As this builds on your leadership in advancing health for veterans, both as United Healthcare and during your distinguished career in the Navy. Both are strong leaders in their fields, and I'd encourage everyone here to go onto the Business Selves website to read their full bios. So let's get started. We must start this conversation with acknowledging that healthcare, as it exists today, is leaving behind too many people who need it most. The pandemic really brought attention to these health gaps and structural barriers, but they've long been there. So we're going to start today by hearing about your perspectives on these health disparities and how do healthcare disparities impact health equity. So why don't we start with you, Jay, and then we'll continue with Tracy.
Great. Well, good morning, everyone. It is an honor and privilege to be here. Catherine, thank you for that kind introduction. And Tracy, thank you for your leadership and work, along with Catherine, on these really critical issues facing our nation. And just want to appreciate the U.S. Chamber of Commerce Foundation for their leadership in bringing this collective dialogue together. So for me, I see the ills of our country show up in my exam room, on my telemedicine visits, in the homes of patients I care for. And I've come to the realization that health inequities is America's chronic condition. We've continued to put Band-Aids on or not even address these issues rather than thinking more upstream about them. And so the way that, I think about it is I give you an old adage: give a man a fish, feed him for a day. Teach a man to fish, feed him for a lifetime. But when we think about the complexity of health equity and that old adage, what about teaching women? What about communities that are historically denied fishing equipment? What about the pond being polluted? That's what health equity certainly, that's how it shows up. That's what it means to us, and that there's differences among people where there shouldn't be those differences. And so how do we give everyone the possibility and the opportunity to have a fair and just shot at health and well-being? And so at Deloitte, we know health equity, is being more than just equal access to care. It is about this fair and just opportunity for everyone to have the highest potential for health and well-being. And we know that health disparities are impacted by drivers of health, and that we use that term drivers of health because of that we believe that things may not be determined, that there are things that drive what happens. And I say, I send my patients back to the conditions that make them sick, the communities that have been historically disinvested in. So we could do everything right clinically, but they could still have worsening health outcomes. And so health disparity is a metric on which we measure progress on health equity. So that's how I'd see the two are connected, and that, I look forward to further conversation.
Great. Thank you again, Catherine, and it's great to be here at the Chamber Foundation. Great to be in person. United Health Group has been a long-standing partner of the Chamber Foundation, and just so exciting to have this conversation today. And Jay, thank you for being here, your leadership. I hope you all will go and look at Jay's bio online, because he's had quite a distinguished career, and he's still seeing patients. So when he's speaking, from real experience. I'm reflecting on what you said, Jay, and I think you're exactly right when you describe what health inequities are. And when we think about that in health, about 80% of what influences a person's health actually happens outside a medical clinic or a doctor's office. And we really look at data at the population level to get insights on what are causing these health disparities. And the United Health Foundation has been looking at this for years through our America's Health Rankings platform. Some of you may be familiar with that. It's really the longest running state-by-state analysis of our nation's health, and it looks at health across 160 measures of behavioral, economic, social, and other factors. And we're able to use this data to really identify health disparities by race, ethnicity, gender, age, geography, income, and education to really inform the actions we take as a company to advance health equity. Last year, we issued our inaugural America's Health Rankings Health Disparities Report, which really focused on the depth, breadth, and persistence of health disparities. And here's some of the things that we saw that were really concerning. Women have a 70% higher rate of depression compared to men. And those with less than a high school education actually had 123% higher incidence of frequent mental distress. Even more concerning were the widening racial disparities that we continue to see in maternal health, which I'm sure we'll talk a little bit more about today. But the persistent disparities for Black mothers and their high rates of maternal mortality. And we look at these, we issue reports at a population level. So we look at women and children, we look at seniors, and we also look at veterans. And I just wanted to give a shout out to the Summit Behavioral Health Care, who won the award yesterday for their work with veterans. As a veteran, I really, really appreciate the work that you're doing. So thank you again. So, and we take that data, and how we put that into action is we really use it to help us formulate our community partnerships. And I just want to give one quick example. When we issued our Health of Women and Children's report in October, we saw that there was a 20% increase in mental distress for children. And even more concerning was almost a 30% increase in the teen suicide rate over the last 5 years. And so we took that data and we established a new partnership with a nationally recognized organization called Active Minds. And I think Active Minds actually might be represented here today, but really great partnership that we're embarking on to establish a new program at the middle school level to try and get upstream a little bit on these health disparities that we're seeing for youth around mental health. We're going to establish this program and implement it in 50 school districts across 3 states, and we're really excited about scaling this partnership going forward. One last thing about America's Health Rankings, we're going to be issuing our annual report in December, where we're going to really provide the broadest portrait to date on the impact the COVID-19 pandemic has had on health, especially the toll it's taken on a number of our racially and ethnic diverse groups.
Tracy, I want to just pick up on this point about data because it's so important that you made is the data drives insight, drives action. But I hear a lot about, well, we don't have the data, we have to go get the data, we have to go find. Yes. Actually, you can interrogate the data that you have and ask the question. So it's the curiosity about what questions you ask. So we looked at even our dashboard with Sergio Ventures, where people in highly vulnerable communities are 32% more likely to have COVID than those that are not. But you even look at the ability to work remotely, highly correlated with education, which has an impact on others. Black, Hispanic, Native Americans 2 to 3 times more likely to die. But so we can even, from gender to place to a number of different places in their public data sets to use. We released a report this summer that's really been a clarion call about the cost of health inequity. So it's not just a moral imperative, there's a business imperative. It's $320 billion we estimate today, $1 trillion in 2040 if we do nothing different, 1,000 per person today, 3,000 per person in 2040. So that's report's available to all of you, but it looks at a number of common conditions where there's differences, and then offers some thoughts about what we can do about it.
Well, some compelling statistics. And I love that both of you, as we've talked about health equity, have really defined that in a very holistic way, right? That when we're talking about health, we're thinking about physical and mental health, but also that we're thinking about individuals, about populations, about subgroups of those populations. So I want to move the conversation a little bit onto access. And we always talk about access as saying, the best healthcare solutions are the ones that can reach the most people. But that is really a challenge. So I'd love to talk about, how you're looking at improving health access, to advance health equity, and what are some of the unique capabilities that you're bringing to kind of form that approach. So maybe we'll start with Tracy on this one.
Sure, great question. When I think about our company's mission of helping people live healthier lives and helping the health system work better for everyone, I think about how we believe that achieving health equity is really helping people live healthier lives, but providing them the care and the support they need to achieve their optimal health. And Catherine, as you said, access is key to this. And we heard this yesterday in the panel with Johnson & Johnson. I thought they did a wonderful job talking about their race to health equity. And I know there are other colleagues from the healthcare industry in the audience today, and I think we're all focused on how do we get at this. And you know, at United Health Group, we've been focused probably for over 2 decades in trying to identify, address, and monitor health disparities to really improve access. And our focus has been on really closing those gaps in care, particularly for vulnerable populations, and providing them both the medical and the social support they need. And it's not only the work we do in the foundation, but as a business, we're really focused on this. You know, United Health Group cares for a large number of seniors across the country, and in our Medicare Advantage program. And one of the programs we've put in place over these last few years is to provide in-home, high-quality preventive care services for seniors, as well as screening these seniors for social determinant of health needs. And we've screened over 6 million last year alone. And we think about access. I think we also need to talk about ability to access and afford life-saving drugs like insulin. And one of the things United Healthcare has done is eliminated out-of-pocket costs for their members for insulin and other life-saving drugs this year. And also providing integrated care in our community pharmacies so for medical and behavioral health care. And we've seen a 90% increase in patients' medication adherence rate. And it also comes back to something that you also mentioned earlier, which is social determinants, providing the necessary food, transportation, and housing that people need to live their best lives. And we do that really in partnership with the community.
That's fantastic. And you know, to everything you're saying there, access is so much more than bringing person, patient, right, to product or technology. If we don't look at that fuller picture, right, then that alone will not be enough to make a difference. Jay, do you want to add to that?
I think, you know, Tracy, well said. And I would say that access is also connected to information. You know, misinformation and disinformation that can impact how individuals may think about access in addition to not having it. So when you have access, you know, I see patients that may have access, but they don't have the literacy to engage and use the care system effectively for them. Or they have information that gets shared across the community that then impacts their ability to access care. But I think what we're at the Deloitte Health Equity Institute thinking through is the 3 inextricably linked issues that we're solving for. One is racism and bias inside and outside the healthcare system. The other is structural flaws in the public health and healthcare system, and then the deep inequities in the drivers of health that Tracy was mentioning. And those 3 inextricably linked problems are ones we're uniquely positioning Deloitte to solve for through a theory of change that includes 3 levers. 1, influencing key decision makers. So we've worked with the Black Directors Health Equity Agenda on a playbook for boards. We've convened 30 organizations through the World Economic Forum's Global Health Equity Network, which we collaborated to stand up, where organizations are making commitments on climate sustainability and equity. And then 2 is strengthen place-based change programs, place-based inequity. So you bring fragmented stakeholders together around issues like maternal health, COVID, mental health, and workforce, and chronic disease so that we get to better outcomes. And then driving health equity innovation, where we're creating a health equity catalyzed cohort with New Profit, which I'll talk more about, you know, to social entrepreneurs, women and people of color and people from rural communities that may not have a platform to drive their innovations forward, giving them that opportunity in a community and support. So, you know, I think that access, affordability, information, and literacy, you know, are all sort of linked together.
Absolutely. And, you know, you're both highlighting that health equity is so expansive, right? It's a huge and complicated thing to tackle. And I know that people often say for complicated problems, there's often a simple solution. That's not the case here, right? For these complicated situations, we often need complex solutions. And companies like Deloitte and United Health Group have invested multi-million-dollar investments in tackling this head on. So I want to now just get very specific on impact, because we know when we go in with investments like that, we want to be able to show impact for that. And we can maybe talk about some of these very specific examples. I'm going to jump back on what Jay just said about the fragmented stakeholders. Would love you to talk first about how you're bringing those fragmented stakeholders together.
Sure. I think that you referenced the investment earlier. That's over 10 years for social impact on education and workforce, health equity, as well as financial inclusion, and all of those elements being important, tied to the work of our Purpose Office, so our Chief Purpose Officer, Kwesi Mitchell, and our citizenship leader, Doug Marshall, really helping team with us to drive that. Since we started, we've launched 20 collaborations in the community across those 3 levers of change that I referenced earlier, touching directly 20,000 people, indirectly nearly 2 million. And an explicit part of the strategy is to, in one of those areas around place-based change, to bring a coalition together. So the Greater Washington Partnership here in this area is an example where we're supporting the work of Inclusive Prosperity, bringing employers, healthcare organizations together, because we know that the ecosystem matters to make progress on health equity, that everyone has a role, and that if you're taking care of employees, if you're paying taxes, you're in the business of health, because every company is a health company in that regard.
Yes.
And so what we've done is invest in ways to leverage new ways of working and leading-edge analytics and research. So New Profit, which was founded in 1998 to catalyze a nascent social entrepreneurship movement, has then backed, since then, 150 social entrepreneurs who created powerful ideas, tools, organizations, and movements to address entrenched social problems. So we've created 2 cohorts, one that we're launching on mental health specifically here in the next month, but one we did earlier around health equity, where we provide 100,000 unrestricted funds, deep capacity building support in a community and ecosystem, and bring various perspectives to that. The other is March of Dimes, where we worked with them to create a maternity care deserts dashboard. And so we can look at the location of maternity care deserts, the quality of care received, as well as the relation between maternity care deserts and drivers of health. And that then helps say, well, what are the interventions we need to drive forward, where, and who are the ecosystem players that can come together on that and play their role. So, when we look at women's health, there is a clear evidence that suggests investing in women's health has a direct economic impact on society. And so that, ends up being an important piece too, where we're focused on also unlocking scale opportunities. So community health workers is another area where it's not scale in this country, but in the developing world, globally, and in other parts of developed countries it has, there's reimbursement, workforce, other issues. So can we invest in a way that unlocks evidence and data and approaches to help scale? The same with diversity in board and leadership. Diversity and inclusion can lead to better outcomes. And when I think about health equity, I think the investment in the work organizations drive forward in it, it changes the basis of competition, because our workforce and communities are looking at companies to what they do in these areas of climate sustainability and equity.
And that's a great point as we think about that from an ecosystem perspective, and building on that really around the workforce. Tracy, I know United Health has a focus on building a racially and ethnically diverse health workforce, which is something that we're really focused on at Abbott as well. Perhaps you can talk a little bit to that and why you decided to start with this approach and this focus first.
Sure, I would. I just want to pull on a few things that you said, Jay, before I go into the workforce, because some of the common things that I heard you say is this has been a journey for Deloitte. It's certainly been a journey for United Health Group. It's years and years of investment. I really, we are so much aligned on the focus on women's health, on particularly maternal health care, and the work you're doing with March of Dimes is just phenomenal to help them target their activities in those communities. And you mentioned workforce. We've been talking a lot about health disparities, particularly in the maternal health area, and what research is showing is that culturally competent care can actually improve a patient's experience as well as their outcomes in care. And if you think about it, in the United States today, Black newborns are 3 times as likely to die as white newborns. And that's just really appalling. A recent study showed that when Black newborns had a Black physician caring for them, it cut that mortality rate in half. And I think fundamentally our health workforce is not diverse today. It's not as diverse as it needs to be in order to provide the high quality care that's needed to care for all patients. You look at the US population, and Blacks and Hispanics make up about 30% of the population today, yet there's only 10%. They only make up about 10% of the doctors and nurses treating patients today. And that's why United Health Foundation has made a $100 million commitment to help advance a more racially and ethnically diverse health workforce over the next 10 years. This is the largest philanthropic investment our foundation has ever made. But it is built on a lot of the work that we've been doing for many, many years. We've invested more than $25 million to help students of color pursue primary care careers over the last 15 years. And we've also invested more than $10 million to help grow a more diverse health data analytics workforce, knowing that's a key part of the health system, working in partnership with HBCUs and organizations like the Atlanta University Center Consortium, as well as University of North Carolina at Chapel Hill, to attract those students into these health data analytics program. And one new program that I'm really excited about is our partnership with the Harris Stowe State University in St. Louis, where we are supporting the development of a bioinformatics program, the first one they've ever had at the undergraduate level. But given the growing disparities that we're seeing and the ongoing challenges, we really felt we had a responsibility to do much more. And that's why we're really excited about deepening and scaling this commitment to advance a more diverse health workforce.
Yeah, Tracy, we're so aligned on, as you've said, because of the workforce issue, tying it to even maternal health. We know that diverse, empathetic care teams can make an impact on outcomes. And then having workforce reflect the diversity of the communities they serve. So we've invested over a multi-million-dollar investment in Morehouse and other historically Black colleges and universities around workforce, upskilling and development, and maternal health, and looking forward to grow in that space. But I think you're giving people the capabilities and skills to contribute. And I often say that health equity moves at the speed of trust. That trust is also so important that the stronger you build trust, the sooner you build it, the better it's going to impact outcome. But you can lose it very quickly as well. So sustaining that trust, and we talk about measuring how are you building and sustaining trust in organizations and communities.
I am seeing some nodding heads in the audience here right now. If you think about the title of this conference, Business Solves, we are hearing that right now, and we're talking about this alignment, across all 3 of our organizations. We know there's many more out there, and I love just how you're getting into this kind of big system thinking of saying this is not just about the workforce today. We think about a lot about the workforce of tomorrow and how are we getting, a very inclusive, diverse population, even being able to go into these careers, right, to help build that future workforce. I want to come back on one thing I mentioned before as we think about making those kind of investments. We're saying they need to be multi-year, with a real long-term. We know that what gets measured is what gets done, but measuring impact is of something that is long-term is sometimes one of the most challenging things. So let's talk about measurement. How are you approaching that? How are you building it in? Jay, let's come back to you on that.
Yeah, I think this is such an important point, Catherine, that you can't improve what you don't measure either. And I would say that bold aims create systems, and systems create results. So starting with a bold aim of what the impact is by when, so then you know what change you're trying to advance in a particular issue. And so, we've looked at the issue of outputs. So these are either short-term, people that have been directly impacted, or individuals trained, and then outcomes, which are long-term results that track for individuals or communities. And we've mentioned some of those earlier. As we think about an overall measurement and evaluation strategy, organizations, we found that can keep these particular areas in mind when selecting metrics. One, strategic alignment, so impacting the prioritized areas. And for us, it's the issues that we're focused on this fiscal year and our theory of change levers that I mentioned earlier, and then the problems that we're solving. So are we making progress on those issues? Feasible. The metrics can be measured with current or planned data and analytics infrastructure that you have. Quantifiable, percent change over a period of time. Attributable, so it should be realistic to affect the change in the metric over the next year, and then 3 to 5 years. And evidence-driven, so existing research indicates that a metric, that metric can address the challenge you're looking to move. And I would say that in health equity, we've also got to think about the ROI differently from a long-term view, indirect and direct benefits, because of the impact on productivity, retention, recruitment, but also as the demographics are changing in our country, that has an impact as well on what happens with health equity. And so, I would just urge that piece as well. And so we're, looking at directly lives touched, but also looking at how we change some of the outcomes and workforce metrics that align with mental health, maternal health, chronic disease. And what we've also found in our recent alternative sites of care report is that greater than 50% of people of color and people in rural communities are looking at prevention and mental health and other modalities. So to this access point earlier, it's also thinking about metrics in a build-on fashion. So there may be multiple metrics over time that build on each other.
That's great.
Yeah, one of the things that you said, Jay, and I love this term, bold aims. I think we talk about goals sometimes. I like that terminology. I may borrow that. But what we're seeing at United Health Group and probably other large healthcare organizations is really making some long-term commitments. For example, we set out a long-term commitment or a long-term goal last year to close 600 million gaps in care by 2025. In the last year, we've made progress closing about 110 million of those gaps. And then we also have a goal, you mentioned preventive care, of ensuring that 85% of the people that we care for get preventative services by 2030. And we're well on our way on that, 69%. So by setting those goals, and really keeping our folks focused on that, and I love the framework that you went through, that was really helpful. I think that's how we're going to make progress.
That's great. Well, I know we've got to wrap up this discussion, so I'm going to bring it back to the title of this panel called Better Health for All. As we're listening to this, we're really hearing that advancing towards true health equity is pushing our thinking and requiring a different approach to innovation about, how, when, who has access to care. So I'd like to just wrap up really thinking about how we shift to get towards those approaches, and how do we truly achieve better health, better outcomes for all. Let's do this as a bit of a lightning round to get us to the end of this panel. So Jay first.
Yeah, I would say that one, we're at a time where I've seen alignment among the public sector, the private sector, and community-based organizations around health equity in a way that I have not seen it in a long time. And so, how do we take that and build and advance a movement around it and embed health equity in systems? And that requires us to look at our own biases, our own assumptions. And we have this 4 domains of action that we look at organizationally. What are we doing internally? Around our policies, our programs, our data, our tech. How do we put a lens of health equity through our products and services? How do we think about our role in the community? And then the ecosystem is like vendor and supplier diversity or policy, those kind of domains. But we've also generated, I think, through this crisis in COVID, confidence for innovation and trying new things. And the public-private partnership paradigm has shifted as well. So challenging our thinking to look at that differently. But I always come back to starting with the perspective of lived experience. What do people I interact with, my patients, families, community members, community leaders, teach me about what is needed? So starting with that obsession of around lived experience and then designing backwards. So, if we're doing, for example, food delivery, digital food delivery, it's still difficult to understand how you got to pay for example, if a payer is collaborating with Amazon Prime on food delivery, the payment for that upfront. If it gets delivered to an unsafe neighborhood, it may not get delivered there. So there's all these, logistical other constraints that we can solve for. We've just got to think about it from the perspective of the person, family, community impacted. And I'd say it's imperative we don't lose the momentum from collaboration that we've seen through the pandemic. And we often hear organizations, and I hear this, that the next normal, the new normal. I just want to make the point that normal didn't work for everyone. So even that language ends up impacting the people you're actually trying to care for and improve their lives. So I think that, that's, I just see a lot of, I think, exciting opportunity. Abbott, United Health Group, and all the organizations I represent at the chamber here are just doing incredible work. And I think learning from each other and lifting up those things that work and say, how do we work together on this issue so that we can drive greater impact?
Yeah, Jay, I would definitely agree with that. And when we think about our focus at United Health Group to really advance a modernized health system, we really can't do that without a relentless focus on health equity. And just to your point around collaboration, we have to do this in partnership with organizations that can connect with people in ways that we can't. Yep. I'm encouraged by some of the innovation I'm seeing, particularly a program that United Healthcare started about a year ago called their Catalyst program, where they're going into a community very intentionally, looking at the data, identifying the specific needs of that population in that community, working with local health facilities as well as social service organizations to really understand the health disparities and what that community needs. And I'll give you an example of one in Kansas City, Missouri, where they're really focused on addressing health disparities in maternal health, something we've talked about today. And by partnering with the local federal qualified health center and 2 social service agencies, they've been able to get more mothers into prenatal care. They're carrying their babies to term at a higher rate, higher birth weights for the infants, and a 90% adherence rate to the postpartum appointments that they have, which is really important, where a lot of the complications arise. And I mention this as an example because you mentioned collaboration. I think that's what this conference is all about, Catherine, when you started the question that way about the business and the community coming together to really solve some of the most pressing health challenges of our time.
Thank you so much. And I hope everybody who's been listening here is both encouraged and inspired by some of these fantastic examples and deep commitment that you're sharing from both Deloitte and United Health Group. The themes that we've heard here I know are not unique to the healthcare industry. And if you're not from the healthcare industry, you're maybe sitting here and saying, how does this really apply to us, right? But health, as we started at the beginning, is really that foundation for thriving economies. It's important for your workforce. It's important for you back at home with your family and your loved ones. And in challenging times, we need to make sure these investments continue. But importantly, I think we need to make sure the other things that were mentioned here today continue. That collaboration. No one's going to solve this alone. We are going to need to work across the public and private sector to put the right solutions together. Both of you really talked about the long-term thinking and this long-term commitment, and we have to keep investing in that for long-term solutions. And then finally, this systemic thinking of saying, this is in the spotlight, right, of these last couple of years because of the pandemic, and a lot of people have really thought that that has been the biggest healthcare challenge. A lot of what we're talking about today, maternal health, reaching populations that have been historically under-resourced and underrepresented, those existed before the pandemic. And so, better health for all is going to keep requiring all of those things, sustained investment and long-term thinking. Thank you so much, Jay and Tracy. This has been a delight, and I think we can all leave, inspired that there are, these commitments for solutions on the horizon. Thank you both.
Thank you.
Thank you.
Thank you.